Hi, welcome. I'm trying to learn medicine today. Amnion, and after that Angioneurotic Oedema, and after that stretching. And if you participate in the stretching, then it's better at your house. First we Amnion, and we did it before. This is the second part of Amnion. And we're talking about internal anatomy, problems during pregnancy, the blood system. And this is no medical advice, we're just reading about it. Now, amnion. That is the membranous sac which encloses the fetus in the womb. Inside the sac, the fetus floats in and is cushioned by a liquid called amniotic fluid. Okay, first, I want to make a presentation in 2-3 minutes. The first thing is the membranous sac which encloses. It is the membranous sac. Maybe I'm going to use just the same words. The membranous sac in which the fetus is enclosed and during pregnancy, and in it is in the womb. And in it is the fetus, and then inside of the amniotic fluid which also cushions it. The bursting of the amnion and release of a fluid usually signals the beginning of childbirth. And then they also say then later on that it is possible to make with an amniocentesis a test of a fluid. A test about the health of a fetus through amniocentesis. Amniocentesis. Okay, I have all the informations. It is amnion, that is the membranous sac. In it is the amniotic fluid. That whole thing is in the womb during pregnancy. Ripping or bursting of the amnion, which is the membranous sac, usually signals the beginning of childbirth. Are the exact words here. And it is also a procedure existing called amniocentesis, which with a needle amniotic fluid is extracted out of the amnion, and it can be tested on things concerning the health of a fetus. I'm going to start the second camera. And let's try. The amnion. The amnion is the membranous sac in which the fetus is during pregnancy. The fetus is inside of the amniotic fluid then. And dripping of the amnion with the amniotic fluid and the fetus in it usually signals the beginning of the birth of a child, of pyruvation. There is a process called amniocentesis. What would I say? Is this cushioned in it? Amniocentesis. The amnion is the membranous sac in which the fetus is when inside of the amniotic fluid. So inside of the womb during pregnancy, there's the amnion, the membranous sac, then the amniotic fluid to cushion also the child, and then also the fetus when inside of the amniotic fluid, inside the amnion, the membranous sac. And the bursting of the amnion, the membranous sac, usually signals the beginning of the birth itself of a child. And there is a procedure called amniocentesis, and by that, with a needle, amniotic fluid is pulled out, and that fluid can be then tested to check onto the health of a fetus. And that is according to Keith Hodgkin's Family Medical Advisor book, page 72, but this is no medical advice. I'm going to step the camera. And we go on to the second thing. Angioneurotic oedema. Angioneurotic oedema. Okay. A form of urticaria or nettlerrash. Tongue, throat, lips and face may become swollen. Very regularly, the swelling is so severe that immediate treatment with an injection of adrenaline is necessary. The cause is usually a bee sting, a food or a drug. Okay, so C, allergy. Okay, angioneurotic oedema. Angioneurotic oedema. It is a form of urticaria or needle rash. Now, these are not many information, so we can do the presentation right now, but the question is, do we include this information about that it is that angioneurotic oedema is a form of urticaria or needle rash? Urticaria. I wouldn't do it because I don't know what it is, but let's look if it is in this book. Needle rash. Nephritis. Very unclear. NETT. Neurosis, night blindness. There's nothing after neurosis. Neurofibromatosis, neurosis, and then night blindness. Not here. And urticaria. Urticaria. Is in the skin disorder, urticaria, fluid passes out of the skin's blood vessels and collects in the skin and its underlying tissues, causing them to swell. The resulting eruptions resemble a sting from a nettle. That is an animal. Nettle rash. Nettle is an animal. Sting from a nettle, and this gives urticaria one of its common names, nettle rash. The other common name is hives. Hives. Symptoms: a swollen area of pale skin surrounded by a red wheal. The wheals may occur anywhere on the body and vary in size from a tiny pimple to a large patch several inches across. What the doctor might do: give an injection of adrenaline if there is difficulty in breathing. Possible also prescribe corticosteroid tablets. Prescribe antihistamine tablets. Different people are suited by different antihistamine preparations, so there needs to be persistence in trying various types in order to find the most suitable one. Outlook: the condition occurs whenever a person is exposed to the cause of the eruption. Once sensitized to something, this sensitivity will last for life. When no cause is found, intermittent urticaria may continue for years. Prevention: unless a cause can be found and avoided, prevention is not possible. Cause: an allergic reaction to certain foods, for example eggs, nuts, chocolate, cheese, fish, or drugs, such as aspirin, penicillin, or other antibiotics. Allergy to a food, drug, or anything else may develop at any age for no known reason. For instance, a person has eaten strawberries or fish for years may suddenly develop urticarial reactions. Okay. Angioneurotic oedema is a form of urticaria or nettle rash. We're not going to say that. Urticaria seems to be the whole big thing, and angioneurotic oedema seems to be one part of it, or a symptom that can occur alongside of it, or something. We don't really understand it, but I don't think it will help if it's said. Tongue, throat, lips, and face become swollen. Very rarely the swelling is so severe that immediate treatment with an injection of adrenaline is necessary. The cause is usually a bee sting, a food, or a drug. Angioneurotic oedema. Okay, I'm going to start the camera again. The camera again. Angioneurotic oedema. By angioneurotic oedema, the throat, tongue, lips and face become swollen, and it can be in rarely severe cases necessary to give an adrenaline injection. The cause is a bee sting or some food or a drug. And that is according to Keith Hodgkin's Family Medical Advisor book, page 75, but this is no medical advice. Also tried with the adrenaline injection. Very rarely the swelling is so severe that immediate treatment with an injection of adrenaline is necessary. Okay, I'm going to the camera. And that was a medical part. Again, this was no medical advice also to be very clear or whatever it was. We just read about it. Now, if you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, then it's better the arms. The legs are standing good and stable, a bit more of a shoulder wide apart, and the breathing in and in from the outside. And breathe out to the side. Breathe again in into the middle. And out over to the other side. Breathe in into the middle. And out the hands down. Now breathe again in. And out and slide with one hand down the leg and the other shoulder stays down. Breathe again in. And out and take one arm over. Breathe in and out in the ribcage. And breathe again out, come back into the middle. Again in. And out and one hand slides down the leg. Breathe in. And out and take one arm over. Breathe in and out in the ribcage. And breathe again out, back into the middle. Now have the feet standing together. And breathe in and lift the arms up. Breathe out, one hand down. Breathe in and reach. And again out. Breathe in and reach high. And breathe out, one hand down. Breathe in and reach. And again out. And both hands down. Again, the feet a bit more than shoulder wide apart, and we're doing shoulder circles. Come back. Front and down with the shoulders in and out, back, up, front and down, and again, front, up, back, down, front, up, back, and down. Now breathe in and let the shoulders up, and breathe again out, and let them fall down. Again, in and up, and out and down. And now breathe in, let the arms up, and reach always with one arm high up. Pretend to take an apple hanging high on an apple branch, to turn it a bit around and then to lift it out. And to the shifter. Next exercise, the shifter. Legs wide apart, arms up to a T and breathe in. And breathe out and slide over to one side. Breathe again in. And out over to the other side. Again in. And out. Again in. And out and lean onto the knees. Breathe again in. And out one shoulder in front. In the shoulder back. Out the other one in front. In and back. Out one in front. In and back. Out the other one in front. Back. Breathe in. And out and we're hanging down. We're doing the Niagara Falls. Just keep hanging down. Breathe again in. And out, go over to one leg. Breathe again in. And out, go over to the other leg. Breathe again in. Out into the middle and close the feet. The side of Angioneurotic stay a bit longer down. Breathe again in. And out. Again in. And come slowly with the round back up. Leg at the top and backwards, shoulder down. Next by the part, breathing down. Breathe in and out. In and up. Out and down. And around, breathe in and up. Out. In. Out. Breathe in and close the legs. And breathe again out. It was the stretching. I thank you very much, and until next time.